Ms. Trautwein, why don't you go ahead, and then we'll just go down the panel, and after we've heard from all of you, then we'll have questions.
Well, thank you, Mr. Chairman. I really am very pleased to be here today. This is a very, very important topic. You know, the rising cost of health insurance is a problem that's driven by the rising cost of health care itself. And so as a part of any health reform package, I just want to stress that it is essential that we do everything possible to lower health care costs. Keep in mind that of every premium dollar, 88% nationwide goes to cover claims, which is health care itself. But I do also believe, and NAHU believes, that any health reform package should also include some very important health insurance reforms, and that we can do this in a way that is both effective and affordable. Now, our members are benefit specialists. They help individuals and businesses purchase coverage on a daily basis. After the coverage is purchased, they also work with them through any problems that come up, and we're very familiar with what kinds of problems those are. In fact, this service aspect of their jobs is the biggest part of their jobs, and it's something that most people are not aware of. And so there is a lot to do with not only getting coverage in place, but keeping it in force. It gives us kind of a unique ability, this very frequent interaction with consumers, to understand what the greatest issues are. And I would share what some of those are very briefly. You know, most people, the biggest response that we get from most people who are covered by employer-sponsored plans, as you indicated, is that they love their employer-sponsored plans. And so I would just start off saying that we strongly believe that any reform package should include employer-sponsored coverage as its core, and that is for large and small employers. We do have, though, today already about 14.5 million Americans that are already in the private individual health insurance market because either they choose to purchase individual coverage or employer-sponsored coverage is just not available to them. And it's for this reason that we've looked very, very carefully at the individual market, which we think is a key place to start with reforms. We've put together 10 very specific policy recommendations, which I'm happy to go through during the course of our discussion today. But in general, what those recommendations do is ensure that coverage is available to everyone, regardless of their health status, that everyone can afford coverage that is not only there and available to them, but they can pay for, that's affordable to them. And I have included a lot of detail in my written statement. I would also say that some of our recommendations also have to do with portability, and greater portability than what people have today. They have to do with what happens when they leave a group plan and let's say they're going to start their own business, and what faces them, and how do they, what are the options in the event that they have a chronic health condition, but they still are going to start this business, what's available to them. So this is what our recommendations revolve around, and I do just want to applaud you for putting this together. I think this discussion is so important, and I think we have a lot of, my fellow panelists are just excellent, and I think that we'll have a good discussion this morning.
Thank you very much. Mr. Williams, please.
Can I just comment on that real quickly? Because, you know, I think all of us think that we have to get everybody into the system if we're going to be able to effectively make these reforms and that they'll actually save money. But not to throw a wet blanket on the whole discussion, but I think we have to be realists about how easy it may or may not be to enforce a mandate. And I agree with Lynn that we have technology that we haven't had before. But this mandate and making it effective and enforceable is going to take a long time. We have 300 million people in this country. We are not the size of Massachusetts or one of the European countries that have been able to enforce it. And it's not that we don't want to do this. I think we just have to look and see what we need to do during this time in which the mandate is becoming more enforced. Because we'll have to figure this out. There's going to be multiple checkpoints we'll have to do. And one of the things that we've talked about in our recommendations is that we have to make sure that there's some system of risk adjustment or a modified reinsurance arrangement to make sure that during this time when we don't really have everyone in the system yet, that we have adequate means so that we haven't made coverage more expensive and done something that's exactly opposite than what we set out to do. So I just want to mention that it's not that we disagree, but we also need to say, yes, we need to do this, and we also need to do this other thing too, just in case it takes us a while to get the hang of it. I just want to mention one more thing on the wellness, and just to add on to what everyone else has said here. You know, you can set up these wellness programs, and most of them are set up based on a patient designing what their own objectives are. And any rewards that they might receive are based on the plan that they've put together. Because certainly someone that's in a wheelchair will have different objectives than someone who runs marathons. And that is critically important to know, that the plan is not the same for everyone. But I really don't think that we do enough to encourage employers today to put these programs together. I think our incentives should be greater, not less, that they should be able to provide bigger incentives, and some of them have nothing to do with insurance. There are all kinds of things that employers can do, and I think engaging employers is the key to making this whole thing work, because, in fact, that's where most of the people are every day. Yeah, I would just add to that, and I also don't think that it is possible for a public and private sector to compete on a level playing field. I don't see any way that that's possible, given the non-rate negotiation that Ron was talking about. And I think when you don't have a level playing field, what happens is one entity or the other is selected against. So I suppose the public program could be set up so that it gets all the bad selection, but more likely what's going to happen is, as Ron said, the private programs will be selected against even more than they are today, and the cost shifting would be exacerbated even more than it already is. And I just think that's a recipe for disaster.